Well, lovely to see everyone here today. My name is Faith Gibson. I'm a nurse and I'm from the UK. And as many of you will know, I've been part of the Saab family for quite a long time. And according to Kate, has just asked me, am I still making lots of trouble? So I hope that continues, if that's the reputation that I have. So welcome everybody, and I'm going to part chair today along with my colleague, Giselle.
Hi, I'm Giselle Scholler. I am from Levine Children's Hospital in Charlotte, North Carolina, and thrilled to be here.
Great. Well, thank you so much for joining us. We've got a few things to say, and as a starter, what better way to start than with this absolutely just a lovely picture. Many of you will know Audrey. If you didn't know her personally, then you may have seen her around at many of the Saab meetings, and she was an amazing ally, I have to say, for nursing, and she was definitely a groundbreaking leader, and we wanted to start off with her. And I'm just going to read out, you can read yourself, but transformed the thinking about neuroblastoma. Mortality rate changed dramatically in the time that obviously she was working. She mentored many people, both men and women, influenced in their careers and lives. And she inspired so many of us. And certainly, as I said, she was a huge supporter of nursing too. And as you know, she passed away. One of the facts that I didn't know was that she was from the UK originally, and I never knew that. But there are some really lovely obituaries around you that you can read, which is just so nice. So thank you, Audrey, for all that you have done. So welcome here. So this is a new Saab network. We're very excited to be here, and thank you to Saab for making this happen, and the machine that happens around Saab to make it all come together on this, our first flagship event. What are we wanting to do with you is to promote female leadership in pediatric oncology, to contribute to building the next generation of talented female professionals in whatever profession part of pediatric oncology they are in, highlight gender equity issues in pediatric oncology. And we'll do this through a number of things, and we want to start slow, make small steps before we get to big steps, and part of that is going to be public events, obviously role modeling, network opportunities, and everyone is welcome across all genders. And so, yes, it's so exciting. So this is us. I've introduced myself already, and I'm delighted to be chair of this group. But of course, nothing is ever done single-handed, ever in Saab. And so there is a steering group, and many of the steering group, there's in fact one member of the steering group that is not here. So I'm going to ask the steering group to stand. So there's myself and Giselle, who you've already met. So please do stand. Sarah is from Canada and France. We have Mita, who many of you will know, Iman, who many of you will know also, and Ade from Nigeria. So this is us, and we've been part of pulling this program together. So what will happen now is I'm going to hand over to Giselle. So this is our first flagship event where we have two women speakers. I'm going to leave that all to Giselle and enjoy. And while they are speaking, please do think of some questions that you would like to ask them. Thank you.
So we are so thrilled to have two very inspiring speakers with us here today, Dr. Kate Mathay and Dr. Raya Saab. We're going to start with having both speakers give their presentations about their journeys, and then have the speakers join us here for discussions and questions. So we're going to save the questions until the end. You can use your app to put in questions, which we'll see here at home as well. Or if you're not going to use the app, then to come to microphones so that the folks at home can hear as well. So our first speaker is Dr. Kate Mathay, who is a world leader in pediatric oncology with specializing in neuroblastoma. We're so thankful to have her here today. She is currently the chief of pediatric hemonc at UCSF Bryn Mawr Children's Hospital. And she's been a leader in the children's oncology group, directing far too many clinical trials for me to name throughout her career. And her career has expanded beyond the USA. She has also led trials in Morocco and has led and inspired the Global Neuroblastoma Network, providing tumor board advice to low and middle income countries. In between 2010 and 2020, they reviewed 412 cases from 32 different countries. So Dr. Matthay has had incredible reach to children all over the world, and we're really looking forward to hearing your journey today. Thank you.
Thank you so much, Giselle and Faith, for inviting me. You can see by my hair color, I'll give you the earlier point of view of what it was like to be a woman starting in medicine in the early 70s. And we'll hear from Raya maybe about how that differed. I think in Saab, we're in good hands as women because the very first president of Saab was Odile Schweisguth, a woman, a French doctor who was, again, a real pioneer, as Audrey was in the US. But there have been a few bumps along the way in Saab and other organizations. So I'll talk about my trajectory, which started in was kind of straight in the beginning and then kind of meandered and then straightened out again. And I may go back and forth a little because of that. In the US, it's a little bit behind Europe in terms of the percent of women in medicine, but more recently, from 2000 to 2015, in pediatrics, the total membership has come up from 55 to 62% women. But if you look at the leadership positions, even in pediatrics, only a third of them, 34%, are occupied by women. Female oncologists who are academic in a survey identified as 63% were in academics, 36% non-academic, but I think that differs in pediatric oncology where it's almost a must to practice in large academic centers. So my journey really began in high school when I got interested in medicine and did some work in hospitals and then did some research during college and finally got into the University of Pennsylvania School of Medicine where they accepted in my class 12 females, which was better than the preceding year where they had about 6 women. And there were 140 males. So it was a little bit lonely, and a couple of the women in my class actually dropped out. One committed suicide. So it was a little bit of a rough time, though I myself didn't have any particular problems other than the usual hazing by the surgeons. But no, I didn't experience any real difficulties being in such a minority, but certainly felt most comfortable in pediatrics where people were friendly and children were wonderful. And I did have the good fortune to be taught by Audrey Evans. Now at UCSF in San Francisco, where I've been on the faculty since 1980, female faculty are now up to 50%, far more than they were when I joined, up from 40% in 2010 and far below that in the early years. But again, only 29% of the leadership, both academically and in the hospital, positions are filled by women. So this is just briefly my trajectory, and I'll come back to some of these things. But again, in 1969, I graduated from an all-women's college where I'd chosen to go to, again, feel more welcome and able to be myself after co-educational public education before that. And then I went right into medical school in 73, and in 76 did a pediatric residency in Denver. So straight on, and then 1980, after 3 years of fellowship at UCSF, I joined the faculty as assistant professor. In that time, if you look on the upper line, I had my first child right at the end of my residency, and one of the highlights of my life is that my husband and I took a whole year off because there was no such thing as maternity leave. And we took a whole year off with our first child, did no medicine, traveled and got used to having a child, and it was a very, very special year after a very busy 3 years of residency where we saw each other every sixth night because of our conflicting call schedules. And then in my early years at UC, I had a second child five years later, and then 8 years later, a third child. We had to space them out in order to get our work done. And my promotion there went pretty steadily, 7 years associate professor and then full professor. Another joy, which I'll talk about more, was that we were able, being at an academic university, to take 3 different sabbatical years. Every 7 or 8 years, you were allowed, if you could find funding, with grants, you were able to take a year to do some other new, meaningful area of research. And we ended up doing a sabbatical in 1991, 2000, and 2010. And also, along this time, I founded, along with my colleagues, the Global Neuroblastoma Network after my third sabbatical, which I devoted partly to global health. And then finally, in 2016, I'm actually no longer the chair of my division. In 2016, I stepped down and actually took official retirement and came back part-time because I had grandchildren, and now I am up to 5.5 grandchildren, which I enjoy. So this picture supposed to show a little meandering of the path, which we'll come back to, but first, I have to acknowledge I would never have gotten where I am today without incredible mentors. I don't think there's a pointer. It doesn't matter. The old-fashioned picture on the right, the man with glasses, is my father, who was a general practitioner in Long Island, where I grew up in New York, and really was my first inspiration to become a doctor because I loved going on house calls with him. Oh, thank you. Yeah, that's my father. And he was very devoted to his patients and was a real general practitioner, delivering babies, doing surgeries. And when I was in high school, he let me observe surgeries and helped me to get a job in our local hospital in the hematology laboratory. So that was my first inspiration. And after that, I knew I wanted to become a doctor. And then in medical school, again, I had my rotation on pediatrics, loved it, and then did pediatric oncology with Audrey Evans, who was indeed an incredible inspiration. I just was fascinated even then by neuroblastoma. Audrey took me in her car to her clinic out in the suburbs, where she mentored me through my first lumbar puncture, which I was very happy to do as a medical student. And she told me all about her training in Scotland before she came to the US, and remained friendly to me really throughout my career. And then at UCSF, my first mentor was Bill Menser, who was the head of our fellowship program, a very good hematologist. And he really taught me how to do lab research and how to write a paper, how to present. He was an excellent teacher, but his interest was sickle cell anemia, and I quickly moved on to oncology. And Art Ablin, who was very active in Saab and introduced me to Saab when we had a meeting in San Francisco, was my champion from the time of my beginning fellowship until he passed away a year or two ago. And he taught me everything I know about patient care and family care, how to treat the whole patient, and always promoted my career with the department chair and the university and everywhere. Was really terrific. And then there were not very many mentors who were female, but Diane Wara, who was our pediatric immunologist, worked closely with me and became a champion of women at UCSF. And later in the 90s, she instituted a committee to look into the salaries of women versus men. And as soon as the committee was formed, the department chair raised my salary by 30% because he didn't want anyone to find out how little I was paid. So she gave me a lot of advice, too. She was very helpful in a general way. So I had a lot of strengths in helping me with my career. I think the great and supportive mentors, which we've talked about. I worked at a wonderful university for both translational science and clinical care. I had very strong collaborators locally, nationally, and internationally. But I think I couldn't have done this at all without my husband, Michael Mathay, who's intensive care pulmonary specialist, who always supported me, pushed me forward, helped at home, helped with the children, helped with work, and has came with me to this meeting so he could watch me get flowers the other night. And the other thing where we were just fortunate, what we talked, in fact, before we had children, if we had a child with problems, we would have to stop work. And we were very fortunate to have 3 very independent, very successful, and loving children who have done very well. So they had to be independent because we didn't have a lot of time to take care of them. I think the limitations, again, were few females around in medicine, few leaders to emulate, and few female mentors, lower pay, as I said, and slower promotion as well for women for no particular reason, probably because we didn't push enough. And one thing is, don't be afraid to step forward and stand up for yourself, which was something I didn't learn until very, very late. And then, so also, this happened when I first joined the Children's Cancer Group. It was quite difficult as a woman to be appointed to a disease committee or to run a protocol. And it took quite a while before Bob Seeger, who I seem to have missed last, but sorry, Bob Seeger, took me on when he saw how interested I was and helped get me on a committee, helped suggest protocols I could help develop, and then became a very close collaborator over many, many years. So that was essential. Before him, I had floundered for about 4 or 5 years in the Children's Cancer Group trying to get involved in anything I could. So, but I think that is totally changed now in the Children's Oncology Group, and there are many, many women committee leaders. And the other thing that was hard for me, and probably hard for other people, especially doing laboratory research, is to get an area of research that melds well with your clinical work and clinical interests, and so that you can go back and forth without being spread too thin. So I started first in the lab studying, as I mentioned, sickle cell anemia and immune function in sickle cell anemia. Then I switched to white cell function. Then I got into targeted therapy and leukemia, and then neuroblastoma. And finally, in the late 80s is when I was able to become more involved in the Children's Cancer Group, and also, due to our nuclear medicine program, began to be able to work with MIBG, because one of our nuclear medicine doctors was a person who showed it was taken up in neuroblastoma. So that led to many decades of work. And then on my first sabbatical, I still persisted in the laboratory, but was beginning to wonder why. And I worked on, in a biophysics laboratory on DNA and RNA inhibition. And at the end of that year, told my mentor there, who was extremely understanding, that this year had been terrific, and it made me realize I didn't ever want to work in the laboratory again. So then I really got, then my path straightened out, and I got very deeply into clinical research in neuroblastoma. I was appointed the leader in 1991 after Bob Seeger of the CCG Neuroblastoma Committee, and helped develop a lot of our important phase 3 protocols. And then 1999, along with Bob Seeger, Judy Villablanca, Rosmar Shelley, and we founded the New Approach to Neuroblastoma Therapy Phase 1 Consortium, which was meant to be quite translational and take developments from the laboratory into Phase 1 studies, targeted therapies. And that, I led that until 2019 when I passed that on to Julie Park. And also, as I mentioned, during my sabbatical, we established, along with Scott Howard and Nehal Parekh, the Global Neuroblastoma Network, which has given me something to continue with during my retirement. If I'm going too long, could you tell me? Because I'm meandering. And then, again, I also got very involved with the Advances in Neuroblastoma Research Association, with the International INRG studies and work, and have really been happy to receive a Lifetime Achievement Award from the Neuroblastoma Group and from Saab as the path straightened out. So this is just to give a little more detail. This was my very first paper, which I did with Dr. Menser, which was and Y.W. Khan, who is very accomplished in thalassemia. And this was about a patient who had a combination of sickle cell trait and hemoglobin H, and we were actually able to do some molecular studies, which were just being learned about at that time and published in the Journal of the Clinical Investigation, this work. But as I said, gee, I'm really not that interested in working with children with sickle cell anemia. I would like to work much more with cancer. And to ease over, I found a lab doing white cell function, because I'd also done some work in immune function in sickle cell anemia. And I went into another lab, which was an example of a bad mentor or a bad fit. I'm not sure which, but after about 6 months, I said no. Whoops, sorry, wrong way. I said, no, I have to leave this lab. It isn't working. And I was also pregnant with my second child at that time, so it may have been a little mental. But, but I took a few months off and went around to other labs doing a lot of targeted therapy. It was at the time of the development of monoclonal antibodies. So I got closer and closer to what I was interested in, and worked in a lab then for a few years, had a couple of R01 grants looking at targeted liposomes, so liposomes carrying chemotherapy but attached to monoclonal antibodies. And I had a nice paper in T-cell leukemia. I did a lot of work with neuroblastoma but wasn't too successful. And as I say, I then was phasing out of the lab. I think that during my translation to clinical research, I've developed some really wonderful collaborators who most of you know here. Julie Park, who then took over neuroblastoma in the Children's Oncology Group. Yael Moshe, I've worked with closely in INRG and COG, Rosmar Shelian and Judy Villablanca in NANT, Sue Cohen in the INRG. And I had to put a few men in there, I apologize, but I've worked very closely with Bill Weiss. I go to his lab meetings and I teach his postdocs about clinical aspects of neuroblastoma, and they teach me about new molecular developments. And we've had a few nice collaborations. And then, of course, John Maris and I have worked closely together for many, many years in COG and NANT, and I've already mentioned Bob Seeger. So this has been one of my joys, working with all these people and many, many others. I couldn't really show everybody, but it has made a wonderful neuroblastoma community. And I thought I'd here just go over the highlights of my career, which have brought me a lot of joy. And I think one of the biggest highlights is really the international collaborations. I've loved all the Saab meetings. I've missed very few of these. I love meeting colleagues, even who aren't doing neuroblastoma. I like hearing about all the other aspects and visiting different countries. I have done work, I visited Ghana for one of the African meetings. I've taught for a week in Tanzania, and I spent a lot of time in Morocco during one of my sabbaticals, going back and forth to Rabat and Marrakesh and Casablanca. And there are some pictures here from some of my friends and colleagues in Morocco and one of the wonderful meals that we had. I have had a lot of fun also working with the Advances in Neuroblastoma Research Group and the INRG with Andy Pearson from England and many other colleagues, and Sue Cohen. And as I mentioned, I've had 3 sabbaticals in France. The first one was with Claude Alain, who sadly passed away in 2003 from cancer, but I was with him in 1991 to 92 in his biophysics. He had a very large, successful laboratory, and he was a wonderful mentor and person, as I mentioned, very kind, included me in all the ongoings and conferences and so on. And I worked with his postdocs and made a few mistakes because we did all our work in French. So I got a few concentrations off by 1,000-fold. And then my next 2 sabbaticals, I worked with Jean Michon, who also is a wonderful colleague and has been very active also in global health, as well as at the Institut Curie, and with other friends here from the Institut Curie and the Gustave Roussy, Dominique Velteau, Hervé Brice, Olivier Delattre, Gudrun Schleiermacher, and many, many others, many of whom are here today at SIOP. And this was just a terrific experience. And then, as I said, I did go back and forth on my last sabbatical in 2010 to Morocco every couple of months to work both on supportive care and leukemia and neuroblastoma, as well as we developed a high-risk protocol for neuroblastoma. And I'm so happy they are regularly doing autologous transplants there. So it's been a long road, but it's really been exciting. So, and then of course all the COG and NANT collaborations. So I think avoiding burnout is a big thing for not just women, but men in academic medicine. And I've been sad to see many of our excellent female fellows and male fellows leave to go to industry because the academic life was too taxing, having to write grants and see patients and do everything at once. But one thing we did is space our children out. The first one and then the second one was 5 years later, and the third one was 8 years apart, so that everybody thought my daughter was the youngest son's mother, which she acted like some of the time. And then again, having a supportive friend or spouse or partner is helpful. And we found we needed full-time help at home. So that was before the days of Instacart and food delivery and so on. So we had people who shopped for us, cooked for us, picked the children up, took them to soccer. We'd try to get there to watch the game, but we didn't always have time to ferry back and forth. And then, as I mentioned, the sabbaticals, if you can do that or even work at a 6-month sabbatical, are critical. Were for us. We were able to take our children on the first 2, and they went to school in France and had a wonderful experience. And then another highlight has been my retirement and caring for the grandchildren now, having some time, more time to play than maybe I did with my children. So my advice to you is to find a lot of good support from family and friends. Be very careful choosing your mentor and your research, who will help you with your research. And as I said, I had to try out several. Don't be afraid to change if it doesn't work out. And you want to find either 2 people, one who will help you with your career and one with the research, or someone who can do both. because it's very important to get good advice for advancement. Try to align your clinical work, if you can, with your research focus. And don't take on too many different responsibilities. You'll be really excited to be on this committee in Saab and that committee at your hospital and this, reviewing all the clinical trials, whatever. But if you get on too much involved, it looks great on your CV, but it does not help your research. And then life balance is what has been critical for me. Some kind of exercise or diversion where you're not thinking about work. I like to swim, used to run, do things like that. Make sure you have some friends or go out once a week to do something, go to a movie. Get your home really organized so you don't have to worry about it. And make sure you set aside protected time for your research, where you're not going to open your email, where you have 2 hours to work on a paper or a protocol or, looking into a complex patient. But take a time where you're not getting bombarded from the outside, and then have time protected for family or friends where you're going to do something on a weekend and not, again, be taking too many phone calls. And don't be afraid. Some people are afraid to take a vacation. They're afraid to take a sabbatical that everyone will take over for them while they're gone, push them out. But that really isn't true. So I just want to thank all of you, and thank you for organizing this. These are some of my family. My 3 children are here, my daughter, my second one, my son, and my youngest son, who's now in his 7th year of surgery. And these are some of the grandchildren: Charles, Caroline, Orly, Mila, Max. And they are really a lot of fun. Thank you.
Thank you so much, Dr. Matthay. And again, we're going to hold questions until the end. Now we're excited to invite Dr. Raya Saab, who has learned to lead in multiple different countries. She's originally from Lebanon, came to the US for residency at Duke and fellowship at St. Jude's before returning to Beirut to lead the Pediatric Oncology Division at the American University of Beirut, and regionally as the scientific director of POEM, the Pediatric Oncology of Eastern Mediterranean Group, and then recently has now returned to the U.S. to become the section chief of oncology at Lucile Packard Children's Hospital, Stanford University, and professor of pediatrics. We look forward to hearing your journey.
Thank you so much. Thank you and the steering committee for inviting me to share my journey and some thoughts about lessons I've learned during this time. So just to take you visually through my journey over the past 20 years or so now. I was born and grew up in Lebanon, which is a small country in the Middle East, where you can see the red dot. And I went to university. I did an undergraduate in chemistry, bachelor's in chemistry at the American University of Beirut, which is one of the oldest universities in the region. And I did my medical school there. I finished medical school in '99. And during that time, as a third-year medical student, I remember I was thinking, about what I wanted to specialize in, and I made one decision, that I was not going into pediatrics or OBGYN, because those were so typically women careers. And I felt I did not want to box myself into that, idea of what a woman should do. And then in 4th year of medical school, I did my sub-internships where you had to stay up all night taking care of patients. And when I passed, through my pediatrics rotation, I realized that I was not upset at the patient who came in at 2 a.m. I was actually excited to go and see them, unlike my other rotations. So that was the first time that I actually had to, listen to my heart or my brain, and I decided to go with my heart. And I think that has been a theme for me throughout my career, is really trying to figure out what I'm passionate about and follow that, rather than thinking about, what has the most job opportunities or what has the, highest pay or And I think this is something that pediatrics in general, people who go into pediatrics in general, are likely the ones who really follow their heart and want to do what they're passionate about. So after finishing my medical school, I traveled to the US and did my residency at Duke. And that was really great. It was quite tough, the first time living away from home. And after residency, I went into, that was when I decided to go into pediatric oncology. And interestingly, I remember I wasn't sure whether I was going to go into cardiology or in pediatric oncology. And then during rounds, I was discussing career options with my attending on service at that time, who was Phil Breitfeld. And he probably does not even remember that, but I was asking him what made him decide to go into oncology. And we had a great discussion, and I realized I saw a lot of what he loved about oncology was really what was pulling me towards it at the same time. And I mentioned this because I've learned since then from my own interactions with students that those times that we give to our students, or our teachers, our professors give to us, can really make an impact on making us realize what we want and what our strengths are. So I've had, in my life as a faculty member, I've had a lot of students come back to me and tell me that I've influenced their choices by sharing my passions and the way that I look at life with them. And that makes me remember Phil as well, and how important it is for us to realize that as mentors and as we deal with students. So after not being sure what I wanted to specialize in, that was the moment of clarity, I think, after that rotation, that this is the patient population I wanted to take care of, not just very importantly for the patients themselves, how special they are in the long-term relationship that you build with them, but also because of the science of oncology, the fact that you're dealing with all organ systems, the fact that you have to be an able and good clinician as well as an empathetic person. So after making that decision, I went for fellowship at St. Jude Children's Research Hospital, and I finished 3 years of fellowship there and spent a 4th year continuing my lab-based research. And St. Jude's is a very special place because you don't have to worry about patient insurance or their ability to pay, so you're able to practice medicine in a way that I think we all feel it should be done, where your main focus is on the patient and you're able to offer them whatever is needed for them to finish their journey. And that's where I became interested in solid tumors, and specifically in sarcomas. I joined the lab of Steve Skapek. Actually, I saw Steve last week at the COG meeting, and he reminded me that when I joined his lab, I came to see him. We had to choose a lab, so we had to go through we had to meet with different investigators to decide who we wanted to meet with. And he reminded me that when he asked me whether I wanted to be a scientist, I told him definitely not. And I told him that I knew I wanted to be a clinician, but that I felt I needed to learn about basic research so that I could later on understand where that science comes from and how it is integrated into pediatric oncology. And he reminded me that he still took me on. And 2 years later, I told him I wanted to stay an extra year in the lab, and I told him that I wanted to look at a position as a scientist. So that was also another transforming experience. And again, just trying to, I think it's important for us as we go through life, not only as trainees, but even later on, not to be afraid to try new things, to see where our passion for science and knowledge and clinical care will take us, because the journey can become much more exciting that way. So after spending 4 years in the lab, I decided I wanted to go back to Lebanon. And that was when I took my first faculty position at the Children's Cancer Center at the American University of Beirut Medical Center. And I was really lucky because so I finished my fellowship in 2007 and took on my first faculty position. And actually this cancer center had been set up only about 4 years earlier through a collaboration between the American University of Beirut and St. Jude Children's Research Hospital. So for me, it was a very natural transition where I knew the strengths of each place and I could contribute to the mission of both. I have to say that that was a transition that required a lot of thought on my part because I knew I wanted to set up my lab and run it. And moving to Lebanon, there's very little funding for lab research in Lebanon. And that's where Steve was a great mentor to me. We had a plan together. He gave me a lot of pointers on what I needed to set together to make sure that I hit the ground running in Lebanon. And actually, when I went to Lebanon, I already had my plans for my lab research. I had my first sort of grant, written out and planned. And I also, before moving, I had a long discussions with my mentors at St. Jude, and notably with Sima Jaha, who has really remained a mentor to me throughout the time that I moved, after I moved to Lebanon, regarding how we can, how I can use my strengths and what I have learned to build programs at the Children's Cancer Center in Lebanon that would align with the vision of both institutions. And again, I mentioned this because I think it's extremely important, when someone is starting with their first faculty position, to have a clear plan on what they want to accomplish and what they need in order to get things up and running, especially if you're joining a small program where there's not a lot of resources that are already available and not a lot of programs that are already there that you could just run with. And this has been an extremely enriching experience. I joined the AUB in 2007, and over the next 15 years, established my lab. My lab grew from initially it was just me and then one research technician, and then I had several students pass through. I had 4 postdocs pass through and several research assistants. And we've published quite a bit on tumor suppression and progression of tumors from pre-malignant to malignant states, and then more recently started focusing more on rhabdomyosarcoma and with differentiation therapy as well as paracrine signaling to the microenvironment and the tumor stroma. I've also been fortunate to be able to contribute to building clinical programs. So we built a program for musculoskeletal tumors that was a national program where we got together all the pediatric oncologists in the country to enroll patients on common treatment plans and collect data prospectively, and to have centralized local control, built a retinoblastoma program, and then again, working within the vision of both American University of Beirut and St. Jude, helped to establish a national network of pediatric oncologists, and then contributed to establishing the Pediatric Oncology Eastern and Mediterranean Group, which is a large regional group encompassing 28 countries. So I've been in Lebanon for 15 years, and then just recently moved to Stanford University in California, and this is now my new adventure, and I just moved 3 weeks ago. So so I get to reestablish my lab, refocus, the areas of lab investigation. I'm much more interested in the microenvironment and identifying the immune modulators of tumor resistance. And at the same time, of course, continuing to focus on pediatric sarcoma patients. I think, looking back at my career so far, I think my major career decision points have been whether to go for laboratory or clinical research, identifying an area of focus. deciding on the first faculty position. That was probably one of the first really tough decisions that I had to decide on where to go and when. And then over the few years that came, that where opportunities can come to develop your career in different directions, if you're hardworking and if you deliver results, you will be pulled into administration. And I think my experience, at least, has been that administration can take a lot of time. But at the same time, it's very thankless as well, especially in situations where the leadership might be a little bit rigid. And I do think that, as Kate mentioned previously, I think you see that across the majority of institutions. It's starting to change now in specific areas of the US. I don't think it's everywhere, but you do see much less percentage of females in leadership positions. So I know, for example, at the institution where I was working, the majority of faculty in the Department of Pediatrics were females. But if you look at the chairs of the departments across the whole hospital, at the deans and associate deans, the percentage really dropped dramatically. So, trying to make your mark, get into administration, and get recognized for that can be still tough even at this day and age. And that's where you need to decide, what you want and what works for you and what brings you happiness. And then relocating is the new decision that I've made to embrace new challenges. And again, I think those big decisions are very important to reflect on and not be afraid to take them when you feel the time is right. This is a quote that I kept in my office when I graduated from residency. The fellowship director gave us laminated cards with this quote on them: "If you love what you do, you will never work a day in your life." And this has really guided me so far throughout my career. And actually, I shared this with you because this was a decision that I was doing a lot more administrative work over the past 3 or 4 years. And then I was going back to my office one day, and I ran into a student. And she was, I think, a master's student. And she said hello. She stopped me and said, "Dr. Saab, you used to look much happier. Like, is anything wrong?" And I realized that I was just frowning all the time. And then I realized that, you know what, maybe I need to refocus on the things that I really love to do, not the things that just need to be done. And I think this is a lesson, to me at least, that you really, every once in a while, every few years, it's very important to rethink what brings you joy and what we are actually doing and whether it aligns with our values and what we want to do for the next 5 or 10 years of our lives. So she helped me correct my course again. My most valuable achievements have really been, I really enjoy laboratory research. I really enjoy the inquisition that goes into that. I love contributing to improving the infrastructure around me, whether it's the research infrastructure, the teaching infrastructure, and mentoring. Probably the most valuable periods of my life have been engaging with students, mentoring them through the research, through lab research, and seeing where they go and what they can achieve later on. I've had fun establishing clinical programs. Being involved in international networks like POEM has been a great highlight. I think we sometimes lose sight of how many amazing individuals are around us working in the same pediatric oncology community, and engaging with that community validates us and gives us more energy to move forward with our common goals, and that has been eye-opening. So citizenship within regional and international pediatric oncology communities really pays off on a personal level. My mentors, as I mentioned, I consider Steve has been a lifelong mentor ever since I stepped into his lab, and even now. And every once in a while, even if we don't speak for a couple of years, he catches up with me and asks how am I doing, and that really speaks to I think the importance of setting up a relationship with a mentor whom you respect and who respects you as well, and who has a real personal interest in developing your career. When I moved to Lebanon initially, I was starting up my lab, and I remember we had weekly meetings where I would tell him what I was doing in my lab and how I was setting this up, and that went on for a year and a half. And that's huge for somebody who's busy to do that for a mentee. So I really appreciate that, and I try to remember that every time I have one of my students who I feel needs me, to try to emulate that as well. Sima Jaha has been a mentor and a friend, and interestingly, when I was at St. Jude, we didn't work much together, but then after I moved to Lebanon and started the program building and aligning with St. Jude, that's where we got to work together, and I've quickly come to rely on her for wisdom, support, direction when at different periods of my life. And I'm very appreciative for that as well. In addition to mentors, there are supporters who come through life that probably they don't know how supportive they are, and I feel I need to mention that because again, this reminds me to support other people when I feel that they need support. So Gerard Evan is a basic scientist who, he's in the UK. I've never worked with him. I met him in a few meetings, and he has been extremely supportive in sharing reagents, giving advice, and he does that with all junior faculty. At the time, I was a junior faculty, and I really felt supported by him and validated during the time that I was building up my lab. And the person, the picture next to him is Nader Jabado, who's a pediatric oncologist in Montreal. And again, she was extremely supportive, just asked her a couple of questions related to lab research. And I try to do the same and be supportive to others. Carlos Galindo, of course, has been extremely supportive, as he is, I think, with a lot of people in this room and Saab. Giselle and Kate, and I don't think they realize it, but during each of them, actually, during different PSYOP meetings, I was at periods in my life where I felt that, I think this is not working, my lab is slowing down, I'm not feeling like I'm confident of what I'm doing. And each one of them, it happened during one of the PSYOP meetings, we just sat down together, and they affirmed, they reminded me. I didn't even tell them that I was feeling doubtful, but they just, remind me, oh, you're doing so and so and so. How are you doing this? This is great. Look at what you've done so far. And these words of encouragement, they didn't know I needed it, but when I got those words of encouragement, it really sort of, made me realize that I need to remember my strengths and not fall into self-doubt. And that also helped me through specific periods of my career where I was feeling like I was slowing down. So I want to thank you both here, and I really don't think you realize the impact that these words have on young faculty as they're trying to move forward with their career. And I do try to remember that now when I meet with more junior people than myself, to remember to be supportive of them and to give those kind words. And they're not just words, and why are they important? Because I do remember that you, each one of you in different ways, specifically said, you did this, you did that, look at what you've done. And they were real examples, and I learned from that as well. So thank you both for that. And then friends who might not be in pediatric oncology, these are two of my colleagues. One is a gastroenterologist, Nadine Yazbek, and Marianne Majdalani is an ICU doctor. They're both at the American University of Beirut, and these are individuals who share similar values, who, when you're feeling angry after a meeting or a committee, or you feel like you're being blocked or your project's being blocked, you sit and have coffee with a couple of friends who share your values, and they give you that affirmation that you're doing the right thing and that you need to move forward. And these are the type of people that you really need to have in your circle, that you can lean on and listen to, and whose opinions you trust. Family, of course, extremely important. These are the upper two pictures of my brothers and sisters and their kids. Friends, on the right, very important to have a circle that you can trust. And of course, trainees and students who can make you proud, and you can, look to them to validate yourself whenever you're in doubt. There are multiple other colleagues and collaborators across the university that, with whom I have mutual respect and that I know have supported me behind the scenes. And I have to just mention the importance of that. And of course, the larger network. These are both pictures from poem meetings. And I've met so many colleagues in this collaborative network that have become close friends and that I have the utmost respect for. And again, they again and again validate the importance of our common mission. So just finally, a few words of advice. I think it's very important to look inwards and know exactly what you want out of your career and do that at specific time points so that you continue to feel enriched by your career and not just be doing the same thing over and over just because it's expected of you. Know what you need to succeed, and this might take some reflection because sometimes if you move forward thinking that you can do something but not recognizing the elements that are needed and negotiating for them up front, that can be setting yourself up for failure. And know your strengths and rely on them and try not to doubt them. Very importantly, don't let someone else set the bar. I feel women in general set the bar quite high for themselves, but that is important. Set the bar for yourself and don't lower it. Don't lower it for somebody else, and don't let anybody else set the limits. If I tell you how many times I wanted to start a program or I want to start a project, and somebody told me, somebody who's superior to me and supposed to give me the resources, said to me, no, this cannot be done, or this politically within the institutional politics, you're going to run into a lot of problems, or nobody's going to be on board with that. But I felt it could be done, and I still moved forward. And I think it's very important to believe in what you want to achieve, and don't let anybody tell you that it's not doable. Just find a way to do it, sometimes without necessarily conflicting directly with somebody, but find a way to do it and get them on board. And believe that right is might, because that's the only way that you can move forward, especially if you're working in a patriarchal institution. Be courageous, take on challenges, don't worry about it. Do pay attention to your mental and physical well-being, recognize burnout, and if you do feel the signs of burnout, identify its causes and try to shift away from what's causing you burnout. Know when to walk away from an administrative role, from a clinical role, from the role that's not giving you the satisfaction. And lean on friends and supporters. Acknowledge self-doubt, we all have it, everybody, males and females. I know you read articles and they tell you that women are more likely to have imposter syndrome, but guys have it too. I think in academia it's very common. Acknowledge your self-doubt, think about it, remember your wins, remember your strength, and just move on and take on the next challenge. And remind yourself to be generous. Acknowledge others, give support, especially to junior faculty, but also to junior faculty and mentees, but also to those who are around you who might be going through a rough patch and you don't know it. Mentor whenever you can. Teach bright students. Be true to your values, and remember to enjoy the journey. Thank you.
Wow. Those were two of the most inspiring and encouraging talks I've heard in a long time. Thank you both, Dr. Matthay and Raya. We'd like to invite you both up. We still have another 15 minutes or so hopefully some people can stay and ask some questions. You're not going to move over. You two take care. And if anyone has questions, if you come to the mic and start the discussion.
Hi, Kathy Pritchard-Jones, past president of Saab now. May I say thank you for such an inspirational launch to the Women Leaders in Pediatric Oncology Network. And as you say, and to everyone for coming to hear these inspirational stories. I think you both really mapped out very well the challenges, but also the successes and how you make that journey through life. And you both have done and continue to do very well at different stages of your career. And as I said previously, I think paediatric oncologists never stop working. So keep going. And Faith, thank you for leading this initiative. I think it's really important.
We have a couple of questions through the chat. One of them says, amazing talk, thank you. Both of the speakers obviously had great mentors during their careers. Question is twofold. How do you find a great mentor, and how do you become a great mentor? In other words, what defines a great mentor?
I think, again, as Raya said, you need to know what you want to learn about. So you try to find an area, but it's good, like if you're going into a lab, to talk to different people in the lab and find out how it functions. Does the mentor actually meet with you weekly or about once a year? And also to find somebody who won't be threatened by your success and block your career. You want to find someone who will mentor you in your career path as well as your research. And that, again, involves, I think, looking around and talking with other people or finding someone else who can help with that aspect if you know you've got to be in this high-power lab with somebody who's a terrific searcher.
I've had some different experiences with trying to be a mentor and on mentorship committees as well. And honestly, I feel that just assigning a mentor to somebody never works. I feel that identifying a mentor, you have to, when you talk to different people whom you respect and you like what they have done with their career, you identify with the path that they have taken or the way that they have thought, and then you sort of test your relationship with them. See how it goes, whether you're able to have those discussions and whether you can get that person to have a vested interest in your career. And I feel that when you find somebody that you share some values with, some core values with, and you share the passion for the subject matter, that's where that relationship develops. But it cannot be forced. So I think the way to find a mentor is just to try to get into this sort of work relationship with different people until you find that those people that you share those experiences, that you have this mutual respect. And I think people on the other spectrum, like the mentors, they are also, all of us, we're looking for people we can connect to and have that sort of mutual nourishing experience. So, they're not just doing you a favor, you're doing them a favor too. So it's a two-way street. So don't be afraid to get to know more people, and then you will see who that. But the important thing, I think, is to maintain that relationship. So even if you move or you go on to your career, if you identify somebody as your mentor, reach out to them. Don't be afraid to ask them. Ask them for weekly meetings. Ask them for monthly meetings. Tell them what you need from them.
I think the other thing that's come to me more recently is some people have reached out to me from other institutions for advice on their career or their research. So you can also, as you mentioned, Gerard Evan, and I reached out when I was in the lab to several people like that for advice and help, more than just collaboration. And you can also, in clinical work, clinical research, find someone in your area and you can reach out to them and see if they will help you with some aspect of your career or give you advice.
Other questions? So another question we have. So you both have incredible international reach in your careers. So what's been the biggest barrier in working across different borders, and how do you overcome those barriers in different countries?
From my experience working in a relatively lower resource setting, and the network that I'm primarily involved in is also relatively limited resources. The major difficulty is really just the lack of time for different individuals to put into the time that is needed to develop these networks and to develop the common vision and goals. But amazingly, everybody manages to find the time, because I think having those networks is so important, and it is so the feedback that you get from it is very enriching. I think starting initially and getting people to join and to get out of their comfort zone and to be involved beyond the limits of their institution or their country is always a barrier. And once you get beyond that, then you see the positives that you can gain.
Yeah, I think my one frustration, I've loved working with people, the doctors, nurses, everybody is very anxious to learn what they can and do what they can. My problem in clinical research has been to get data management in these other countries. There's many of the low middle income countries have zero support for data managers. They haven't even thought of it, and sometimes you get support and it lasts for 6 months or a year, and then you're back where you started. So I think one thing that would help in global work is finding a source or a foundation who wants to support that. And are you going to tell us who?
I'm kind of Santa Claus today. Guillermo Chantada, current Saab president. Well, we have a project at Saab which is called PARC. It's a program for advancing research capacity in low and middle income countries. And one of the major issues that it's going to deal with will be support data management in low and middle income countries. The project has already started. We already funded 3 proposals from the 3 different continents, and we are considering funding the 4th. So I think I fulfill your dream.
That's terrific, and I hope they will. Even more important than the financial support is training research assistants, because many of them have no knowledge of reporting adverse events and things like that. So it would be wonderful, like our cancer center trains our new research assistants at the University of California, but if we had an international online kind of training courses.
Thank you, Tessie. If you move the slides on, yeah, thank you. Yeah, thank you, Sarah.
Social media, being on the internet, of course I would show up. Join us. There's some information about the network, the WLPO network on the website. Join us on our LinkedIn. It's a closed linking group to encourage honest and open conversation, but you can apply with your LinkedIn profile and we will let you in. And follow us on Twitter. More is coming. We're very excited to have made this happen in such a short timeline, and I want to say thank you to everyone again for making it happen. But you will see from us more things to come throughout the year until we can meet in person in Ottawa again, and our next event shall be in December 2022 virtually. And this is a QR code that you can scan with your phone or tablet to give us feedback, because obviously we want to hear from all of you about what we should be talking about and putting forward next within our group. So I'll leave it up so that you can scan it or just snap it and go to the SurveyMonkey. Oh, sorry, I'll leave it. I see more people with their devices. And welcoming all voices. Yeah, and that's it. Finally, thank you so much for joining and supporting gender equity in pediatric oncology. Thank you, ladies.